In this video, I'll be introducing the TBI Connect program. This is a program that we developed to help people with a traumatic brain injury and their family and friends have better conversations together. We need a range of skills to be able to build a good conversation, and these skills are often affected by a TBI. Firstly, we need to be able to access the correct sounds and words and construct these into sentences. Sometimes people with TBI will have difficulty at this level and they might have trouble finding the words that they want to say. However, it's more common for people after a TBI to have difficulty with some of the more complex processes that are part of having conversations. For example, memory is often affected, which means it might be difficult to remember things that have happened so that you can talk about them, or it might be difficult to keep track of what's already been said in the conversation. It can also be difficult to organise your ideas, which can make it hard to explain something complicated in a way that will make sense to the other person. Choosing the right thing to say can also be difficult. For some people, they might find it hard to think of what they should say to get the conversation started. For other people who've had a TBI, they may have lots of ideas of things to say in the conversation, but they might sometimes end up saying things that aren't quite right for the conversation, and then they end up coming across as a bit rude or inappropriate. Another issue that's common after TBI is managing emotions. People might find that they get frustrated or angry more easily in a conversation, or they might feel that they're less confident or less engaged during their conversations with family and friends. It's also common after TBI for people to have trouble recognising and responding to the emotions of other people in the conversation. So all of these things can really make conversations between people with TBI and their family and friends more challenging. That means there can often be a sense of disconnection because communication isn't happening in the way that it used to. To help people with the problems with conversation that can come up after a TBI, our team developed the TBI Connect program. The aim of the program is to improve communication and conversations after TBI. The program was developed by a team of speech pathologists based at the University of Sydney. It was based on research evidence from clinical trials about effective ways to help people with TBI and their family and friends have better conversations together. The program involves completing 10 training sessions with a speech pathologist. The person with TBI plus one of their family members, friends or carers attend the sessions together. And the sessions cover a range of topics related to positive conversation skills. We think that including a family member, a friend or a carer, what we'd call a communication partner, is a really important part of the TBI Connect program. In one of the studies that has been done by our team, we compared the outcomes of two types of training. In the first type, we worked just with the person with TBI. In the second type, we also included a family member, a friend or a carer in the training. We found that the training where we included those communication partners had the better outcomes. This finding makes sense. After all, communication is a shared activity. It's something that we have to do with another person. It's not something that we can do on our own. Also, it can be difficult for people with TBI to keep motivated or to remember what was discussed in sessions, and so the communication partner can play a really important role as a teammate and as a support person for this program. As a final point, we know that family members, friends and carers can struggle to communicate well with the person with TBI. And so the program is aimed at helping communication partners manage those challenges and to know which strategies they can use to create more positive conversations. So after hearing this, you might be interested in accessing the TBI Connect program. We will be making the manual and the resources available to speech pathologists in Australia and internationally over the next few months. If you're already working with a speech pathologist, you might want to mention this program to him or her and ask if it could be a good option for you to explore. If you're living in Australia and you're not already linked in with a speech pathologist, we'd suggest using the Speech Pathology Australia website to help you with finding contact details of someone who can help you. On the next slide, I'll just talk you through how to find that information on their website. So looking here at the Speech Pathology Australia website, you can go to resources for the public, find a speech pathologist, and you can then search for a speech pathologist in your local area who works with people who've had an acquired brain injury. Another option is to search for a speech pathologist who offers sessions via telepractice. And that means that you'd have your sessions using video conferencing from your computer at home. So as you can see, you can similarly search here for speech pathologists who work via telepractice with people who've had an acquired brain injury. There are also a number of resources that we are making freely available to people with TBI and their families online. The first is the YouTube channel where you're watching this video. In this channel, you'll find some example conversation videos which we use in the TBI Connect program as a starting point for discussions. In the coming months, we'll also be adding some TBI Connect research videos where we'll be discussing the key findings about this program that have come out of our research. In the information section for this video, you'll see a link to a website which has some free resources. On that site, we have an information sheet for families and a list of suggested practice conversation topics. We're keen to hear from families with feedback on the resources that we have provided, so do feel free to leave us a comment on this video, or you can also connect with me on Twitter @Rachel Redeck.